the assignment for the group 2.
Okay.
Please focus.
As we discussed, the problem in our country is mainly the same. That's why I will present the problem. And in this Romania, I was trained to university health coverage. Many citizens face high out-of-pocket expenses for medicine and hospital services. I will implement small monthly contribution by working adults for low-income family, children, and elderly. Partnership with public and private hospitals to ensure wider access. Gradual rollout, strengthening the capital from big from the capital to a region, expanding to the region. Base emergency services, improve financial protection, higher quality services. So all these things that we are planning to do must making policing constitutional technical documents, starting with these documents.
So, what is your major problem you are addressing?
Yes, our problem is small monthly contribution by working adults to give it to family, children, low-income families, children, and elderly. So, if you want to ask
Free health. So their topic is free health care to the vulnerable population, people who are poor. You want to provide them free health care. Yes. Go ahead.
Okay, so part B of our question was to write a few feasibility issues. The first issue obviously is funding, for example, as percentage of GDP of the country. The other issue we identified was most of these people are in informal employment, so it's hard for them to ensure that their employers provide this coverage for them. Then the most important issue here would be also political will. So depending on the government in place, they may not be willing to take this route for the people. Yes. And part C of our question was just a moment. Part C of our question was to suggest possible reasons why the Kingdom's three streams might meet, leading to a problem moving onto the policy agenda. So of course we identified a problem, which is a big enough problem. A lot of people can't afford out-of-pocket health care in these countries. And in terms of policy, depending on the structure of the policy done by the technical policy makers and the feasible ways into which we can get this funding, might lead to convincing the politics, which is the government, to find better ways of funding this free healthcare for the vulnerable people. This could be, for example, by increasing the budget allocated to healthcare services within the country. Yes.
I think a very good example and very nicely explained. And how many of you in your countries free healthcare is provided to the poor or to the needy ones or the vulnerable? How many countries? In your country is it free?
Yes.
Extreme, like everything is covered? No. Not everything must be covered, some part. So their policy topic, the change which they want to bring was very good because their topic was that they wanted to provide the entire free healthcare services to the needy ones. They rightly pointed out what feasibility issues can come.
But in our country, almost everything is free unless it's specialized that everything has to go outside the country.
Okay, which country?
Malawi.
Malawi. That's nice.
In our country also everything is safe for every level of people. If they are consulting in the government.
Okay.
Like for the private sector, we have like
Partially coverage. So in our country we have an insurance system. So to the needy ones, our country provides them certain cap where their entire the family is covered, and that is given in yearly basis. So in our country also lot of facilities, the public facilities, they provide free treatment. So in our country also we have, but I think the topic was very good and well attempted. So now I think we can go ahead with the movers. Okay. So your topic was king and model, right? A case and application of the case.
Thank you. Thank you to the movers and the corpus for giving us the opportunity to represent our distinguished colleagues. So, based on the case scenario, using the kingdom model, we were able to identify the problems and the production, distribution, and consumption of pharmaceuticals, most especially 1,500 essential drugs and 100 supplementary drugs relative to low cost. Because the issue of medication payment is essential. It is affecting the masses all the years, most especially underdeveloped countries and developing countries. So developing such policy is important to help transform the health sector of our people. And then we were also able to look at what are the political ways, because we must see the political way before we have a solution. So the political way we saw there, our political stream, is the formation of the drugs policy, or firstly the change of government. The change of government was a great challenge because when government changed, new government comes in with new ideas, it comes in with new policy, it comes in with new dimension that they want to use to promote them so that by the next election they are being able to get power. So the change of government affected that policy, and that led to the formation of the drugs policy, which was initiated by a group of concerned physicians and others with close links to the president, because those people came on board, they are now close to the president, they want to show to the president that they can work, that whatsoever idea they have to promote him. So that was part of the greater thing that they had to do. And that also led to the gender secretary was not included, and a certain group of people decided that no, let him stay on that side, because if he's saying this, he's not going to buy the idea, he's not going to support. So I want to turn over to my colleague and she can sum it up. Thank you.
So as Abraham has explained, for the kingdom model, we have three, which is problem, then policy and politics. So for the first thing, we identified the problem is it is drug production and distribution of pharmaceuticals. And as a solution, it was taken as 16 guidelines were established with the drug policy. So as a political, it was mentioned that people were taken who has conflict with the new president, and for the time being, they were waiting for the new president to arrive, so it will be easy for them to establish the policy. And also they have excluded some of the members as it can interrupt the policy adoption in the country. And like pharmaceutical industries were included from the committee which were formed for the policy making.
Thank you. So thank you. Our take-home message is the declaration of the island, which has given rise to the 16 guidelines to regulate the pharmaceutical sector. Once we establish that, that will help to regulate the pharmaceutical sector, and the issue of political will and the issue of physician interest will be curtailed by that regulation. Thank you.
I think very nicely explained. So those three streams finally met. The three streams. So you were able to, in this case, the policy window was opened?
Yes.
Yes.
Yes. Because all the three streams somehow, there was some biasness, some political issues, some political factors were interfering, like they usually explain. So I think very nicely, very nice. So should we go with the hall model quickly, because we have exceeded time? Hall model, you want to go? You want to present? But we just have 2-3 minutes. You want to present?
Well, we can present from here.
Yeah, you can present for me. That's okay.
So we were going through the whole model. So in the whole model, we have to look at three things: the legitimacy, the feasibility, and the support. So in this case, we thought it was not legitimate because the government was taken in by force. So it was not democratically elected government. Two, he was not a people chosen leader. He took the government by power. And then this was the army chief's interest. So we are looking at the interest of one person. But also there is no transparency in the choosing of the committee. The people that have been mentioned are people that were close to him. The other parties are not involved. But also, this was a conflict of interest of other people as well, with head of a doctor, of someone who was involved in another pharmaceutical company. He was pushing for his own things, and then he found himself in the committee. So we thought this was not legitimate.
Very good.
One. When we come to feasibility, we said in as much as it was a forced thing, but it was feasible, because they had the government support. They had the knowledge. There were people who were from the pharmaceutical, there were people who were physicians, so they had the knowledge, but also they had the infrastructure was already there. But also we have been told that 1,600 products were taken away from the whole essential drugs, but they remained with 150. And of these 150 essential drugs, they were imposed both on private but also on the public facility. So the administrative power was there. On the support, there was a problem. There was no stakeholder analysis. The people that were on board were the people that were close to the army commander, meaning they could not say anything against him. The people that could have spoken against him, the general secretary, were put out. So it means the opposition was not there. The people that were there were people who just say yes, yes, yes to the interest of their own, but also to the interest of the leadership. So there was no support at all. Thank you.
A huge round of applause for the group and Doctor, because I think very, very nicely explained, and the special effort has been put by the team. They drafted a presentation. A clear-cut message was given. I think all of them enjoyed it, and you made the kingdom model, all model presented in a very easy way. So very good, very well done. So the last two groups. Okay, on the table. Yes, congratulations to doctors too. So the last table wants to present. Or you want to present? Okay. We can quickly take it. Yeah.
Disease and the healthcare fragmented, and the challenge, another challenge is workforce shortage. So we choose diabetes problems. So the comprehensive to reduce diabetes patient is our policy.
Sorry, I couldn't understand. The problem is NCDs.
About the diabetes patient.
Diabetes patient.
Okay, so we use HOLES model in diabetes patient management. So the first
Diabetic patient management is your topic.
Yes.
But what do you want to do for the diabetic patients?
we have basic policy, but we use HOLES model to.
Okay, explain that.
Okay, the first one, legitimacy. We will do like less sugar product and screening diabetes type 2 in community or the school or workplace. Or we will like provide about public awareness for the legitimacy. And for feasibility, maybe we have a look like the man, like the doctor, the health professional. Money we will use like because we have to spend a lot of money from like screening or treatment. We have a look like the information, like evidence-based intervention, data of the patient or mapping of the healthcare for diabetes. We also look at the infrastructure like tool availability, monitoring, or like the high or low contact culture. And for the host model, the last one is supporting, like the supporter, like the supporting maybe like people against us, like the company that they produce, the Coca-Cola or something. And another type, maybe we like the supporter, like the hospital, the team, the diabetes team, or financial from private and public sector. And for the supply chain of the policy, we have to look up at the upstream, midstream, and downstream. For the upstream, maybe we do like less sugar, less tax, Okay, or maybe like advocate the company like about the sugar-free products. Yeah, and or like we have the campaign like less sugar, better health, or something like that. Or the community screening. And for the midstream, maybe we do like the basic healthcare about like screening diabetes or professional, like we do bariatric surgery to cut your stomach to then let you cannot eat a lot of food. Or we do like the patient health management program. And for the downstream, we have to decrease diabetes patients, decrease the complication like diabetic retinopathy, diabetic polyneuropathy, or like diabetic chronic kidney disease. Yeah, and also we can list down the cost reduction measurement for the diabetes patients. Thank you.
Thank you so much. I think well thought. But my doubt here is that your topic was unclear. Basically, policy topic is something which is new and has not been introduced. The things which you had explained are the approaches or the factors what you will actually do to fulfill the policy. But the title of the policy was not clear. In diabetes, what do you want to do? It is like you just wanted to improve the diabetic services in the country and how you will do it. But this is not a policy topic. Okay? So we can think of, because we'll go ahead in our next sessions, so think of a policy change which you want to bring. Okay, good work. A huge round of applause for all the teams. Very interesting discussion.